is also Fam and my channel is about all things PA. So what's patient care hours and what's healthcare hours? It can be a little confusing, but I got you covered. According to CASPA guidelines, patient care experience is when you're directly responsible for the patient's care. And healthcare hours is when you are in a health-related field, but you're not directly interacting or helping the patients. So some examples of healthcare experience would be when you're filling out prescriptions, calling insurance agencies on behalf of the patient, cleaning their rooms, changing the pillowcases and bed sheets, calling patients to schedule their appointments, documenting stuff, things like that. Patient care experience would be when you yourself are prescribing the medication, treating the patient or performing procedures, or working on patients like as a nurse or paramedics, EMT, CNA, stuff like that. And the way I split up my hours is by saying that I spend about 80% of my job doing patient care work and about 20% of my job doing healthcare. So let's say I had a total of 2,000 hours from my jobs to report to CASPA. What I did is I took 80% of those 2,000 hours, so 1,600, and I mentioned those under patient care hours, and I took the remaining 400 hours, or the other 20%, and I mentioned that under healthcare hours. And that is how I split them up. Because remember, you cannot double dip on CASPA. You can't say you had a total of 2,000 hours and then list 2,000 under patient care and the same 2,000 under healthcare. That is a no-no. So in order to give you a better example of how these two things are similar and different, let me go ahead and break down my job responsibilities. So the first job I want to talk about is being an exercise specialist in a physical therapy clinic. So as a part of my job, I would go get the patients, ask them how they're doing, get their chief complaint. I would do a quick review of systems, as in how they're doing physically, emotionally, and every other health-related category. And then I would guide them through their treatment plan. So we mainly focused on treating knee, back, shoulders, neck, ankle pain, and improving balance as well. So for my patient care experience for this job, I mentioned that I supervised these patients with minimal involvement from the PT. I corrected their form throughout the session and made sure that they were doing the exercises properly. And I also had to teach them how to do the exact same regimen at home as well that they had to do by themselves. I mentioned that I took detailed notes for the physical therapist to review so that they could update the treatment plans for the patients if necessary. Now for the healthcare experience portion of the same job, I mentioned that I helped maintain the facility cleanliness and I did clerical work. So to elaborate on that, I would do a lot of laundry. I would wash all the bed sheets, change out all the pillowcases after each patient, wipe and clean the beds, start getting some of the equipments ready for the next day, and print schedules and make sure that I call the patients to confirm certain appointments. So when I was not in direct contact with the patient, but I was still doing healthcare related stuff, those I categorize as healthcare. When I was directly involved with the patients and I was instructing them on how to do their exercises and correcting their form, those parts I counted as patient care experience. Now let's talk about another job that I had. I was a technician at an eye clinic, and for that job, I did the entire eye exam for the patient before they even got to see the doctor. And I sent them for testing if the doctor had previously ordered it. So pretty much the patient would get there, they would sign in at the front desk, and from that point until they see the doctor, they mainly work with me. I do their entire eye exam, checking their glasses, prescriptions, checking their near vision, distance vision, their peripheral vision, checking their pupils with the pen light. I would also have to refract them, which is when we ask which one looks better, number 1 or number 2. Check their angles, dilate them, check their color vision, check their depth perception, pretty much everything you can think of when you go to an eye doctor. So for this job, when I was talking about my patient care experience, I mentioned all of that, plus I talked about how I take detailed ocular and systemic history. I get the chief complaints from each patient and check their medication list and write down how many times they're taking certain medications. Now for the healthcare experience portion for this job, I talked about how I handle the triages. I would call patients back, I would answer their questions, I would send in their refills. I would call insurance company on behalf of the patient and try to authorize certain medications or send in alternative drops that would be approved by their insurance. I would have to call other doctors' offices for getting documentation, or I would call the pharmacy to send and receive documents and to make sure that they're getting their refills. And also when needed, I would scribe for the doctors, I would scribe for the physician assistant, especially when they were doing H&Ps, I would try to go observe. And of course I had to clean. I had to clean all the equipments before getting each patient, and I also trained new technicians when they joined the practice. So that was a quick breakdown of how I differentiated my patient care hours versus my healthcare hours. My main thing was that if I am in direct contact with the patient and if I'm helping when it comes to taking care of them, I counted that as patient care. However, if I am not in direct contact with the patient, and if I'm helping them over the phone, or if I'm calling the pharmacy or insurance on their behalf, or if I'm even cleaning the equipment to give them a better experience, then I counted all of that as healthcare hours. Alrighty fam, I hope this helped clear up a little bit of the confusion. If you have any more questions, please comment them below and I'll get back to you as soon as I can. And of course, if you're interested in how to be a PA, please subscribe to my channel. Thank you for watching!